Gynecologic oncology is one of the few specialties where you get the opportunity to do both advanced surgery as well as provide chemotherapy. Other fields like breast have a breast surgical oncologist and a breast medical oncologist, but gynecologic oncology is one of the few that does all, and that's what I loved. Additionally, I looked at other specialties like urology, etc. But what I found out was I just love working with my women. It is amazing how strong these women can be, and despite all that they're going through, how they still lead their family through the journey with them. So the biggest risk factor for developing any cancer is age. As you get older, your risk of developing colon, lung, and other cancers increases. So that's the same for ovarian. Other things we worry about as risk factors for ovarian cancer is your family history. Do you have a history of women or men with ovarian, uterine, colon, or breast cancer? Because some of these can be hereditary, meaning you inherited a gene or a problem from your parents that puts you at increased risk over the general population. For ovarian cancer, we don't have an easy screening mechanism. It's different than colon cancer with a colonoscopy, cervical cancer with a pap smear, or the more common breast cancer with mammography. Unfortunately, we have to rely on women knowing their bodies, knowing the side effects, and coming in to see a provider and say, hey, this isn't right. For some of the women who are at higher risk, who already know that they have a genetic mutation because their family members have had a cancer and they've been tested, they can have additional testing with ultrasounds and blood work, but we don't do that for the general population because it's so rare. So the most important thing to know about is say, do I know my body? Do I know the symptoms of ovarian cancer? What we find is women present with general symptoms. The very first one is bloating. You have that fullness feeling. Unfortunately, you can get that when you put on a little bit of weight or you eat the wrong foods. So women usually attribute it to something else. Then they can have something called early satiety, when you can only eat little bits at a time before you really feel full and you just can't get any more in. Then it can lead to changes in the way you void or how you have bowel movements, increasing pain, etc. So that's unfortunate for us because we don't have a specific side effect like bleeding for uterine cancer. Women come in earlier for bleeding, but those vague symptoms, it might take a while before they show up. And that's why we find most of our cancers in later stage 3 or 4 disease as opposed to earlier stage 1 or 2. Most cancers are stage 1 through 4, with stage 1 being local. So for ovarian cancer, that's confined to the ovary itself. Stage 4 means distant spread, meaning the cancer is spread from the site it started to elsewhere. For ovarian cancer, that's starting in the ovary, spreading up into the lungs or inside the liver or even elsewhere in the body. What we know is stage 1 cancers have about an 85 to 90% cure rate, meaning your cancer is not going to come back. Unfortunately, with stage 3 or 4 cancers, which is the bulk of our diagnoses, we know that your odds of surviving at that 5-year mark are only about 50%. It's better than it used to be. It's increasing by about 2 to 3% per decade, but that's slow growth. So we're really working on better ways to improve that. How can we do that? We need to improve on researching to find out better ways to pre-screen for ovarian cancer. And that's one of those things we lack right now. We are involved in some trials where we are collecting tissue samples and evaluating normal versus abnormal tissues to see what would be that marker. Eventually, we hope that someday you will go to your primary care doc, give a tube of blood, and they'll be able to screen you for a whole bunch of cancers just from a tube of blood. We're not quite there, but here at Orlando Health, we're working towards getting to that goal with our partners in research as well. Estimate of what your risk of recurring is and whether you need additional therapy or adjuvant therapy. That ranges from targeted therapies to systemic chemotherapy. It could include radiation, although less likely with ovarian cancer. We here at Orlando Health find it very important to treat the entire cancer patient. So mind, body, spirit is important because all of those things we mentioned, surgery, chemotherapy, working with our radiologist and those other physicians is important. But taking care of you, taking care of the people who help take care of you is important. So we do a lot of non-medicine related therapies, meaning we have a team of nurse navigators to help you through this system to make it easier for you because you already have a lot on your plate. We have integrative medicine available, such as acupuncture, cupping, massage therapy, lymphedema clinic, pelvic floor rehab, all these things that are going to help you get through your battle with cancer well as once you're through your battle with cancer, your survivorship has a good quality of life other than, I made it, but I'm still suffering. The most important thing when we're talking about monitoring for ovarian health is going to be to know your body and know the symptoms. Everybody has occasional constipation or diarrhea, occasional bloating. But if these things come on, stay on, get worse instead of better, you really need to see a provider. It's also recommended that all women get an annual GYN appointment every year. That doesn't necessarily mean you need a pap smear or a pelvic exam, but when you discuss these issues with a provider who's in the know, they can help you ask the right questions to say, I am a little concerned about this, we need a little further investigation, versus you look good, come back and see me in 1 year. So prognosis and survival for ovarian cancer definitely has a lot of room for improvement. Unfortunately, it is in the top 5 of the most deadly cancers, and that's because we don't have a good screening mechanism as compared to pap smears or mammograms. Despite its rarity, its high rate of mortality or complications is because we find the majority of it in that stage 3 or 4 that's harder to treat. Currently, our 5-year overall survival rate is about 50%. That's improved from about 30% in the 80s. Why is that? 1, we have better treatment options. 2, women are having better access to care and paying attention to themselves and making sure they're going to be seen for these. 3rd, we have better medicines to help us with you, treat you for that additional adjuvant therapy you might need. We see movies all the time about people vomiting excessively with chemotherapy. We hear horror stories about when I took care of my mom and she was undergoing chemo. Not all chemo is the same. We have better medicines today to help manage those side effects, as well as all our alternative medicines to help manage those side effects. So it's very important for me to let my patients know that although this is a tough journey, it is manageable. We're doing better now with that 5-year overall survival rate of 50% than we were in the past. Again, we still have room for improvement, so I strongly encourage everyone to enroll in clinical trials and to donate when they can to ovarian cancer research. We're rare, we don't get to pink out the park or things like that, but we're still looking to find a way where we find this earlier for all of our women.